Very good. Our final presenter here this morning is actually, I think, going to drill down a specific example in this area. Dr. Jennifer Brett is a naturopathic physician and an acupuncturist who's at one of the universities in the U.S. now that actually has multiple programs across these integrative disciplines. And she's going to be describing an integrative clinic setup there at the University of Bridgeport.
Thank you. Yes, so at the University of Bridgeport, we have a health science division that is quite diverse, from physician's assistants to the Phone School of Dental Hygiene, acupuncture, chiropractic, and naturopathic medicine and nutrition. I think we all experience the fact that in the community, patients are putting together their own teams. Liza just talked about that, and that these teams of healthcare professionals are often not talking to each other. They're only talking to the patient. And so the patient is stuck in the situation of deciding which information to give to which practitioner. And what we found at the teaching clinics at the University of Bridgeport was this was happening in our own teaching clinics. We're all in the same building, and yet patients were giving different pieces of information to different practitioners within those clinics. I mean, this kind of falls into that standard model where the patient and families are expected to create their own care, and that they may tell their medical doctor that they're taking aspirin, but they may tell only their naturopath or their acupuncturist that they're also taking St. John's wort. And so we find that we don't have all the pieces we need to really create a long-standing health for the patients. So what a core group of health educators at the University of Bridgeport wanted to do was to teach students who will then become practitioners in the field both team-based care and patient-centered care, and started having focus groups on how this could work, because there are barriers, traditional silos between the various departments, issues with accreditors. How do you give credit to multiple members of a team for the same patient care? And supervising clinicians had skepticism, to say the least. So what we did was the interns from the 4 disciplines that have a university-based healthcare clinic, which is dental hygiene, acupuncture, chiropractic, and naturopathic medicine, are now pooled together to see the same patient for a 2-hour block to do a thorough assessment. Mind, body, spirit, and teeth to toes. The students are then charged with looking at what that patient reported, what their perspective on the patient's health care would be, and to look at evidence of what would be helpful for that patient from their particular perspective. And then they come back and do a full case review with both the supervisors for all 4 of those clinics as well as the students themselves, and have to come up with a single plan of care for the patient that incorporates all parts of the patient's health. So we really focused on that patient-centered care and evidence-informed care, where that is not necessarily the focus in a teaching clinic, which is often on student competencies, making sure they get what they need to get for their own education rather than necessarily what the patient really needs. And the aim is to understand team-based care for the intern, but also healthcare options for the patient, and to communicate better across our different disciplines. So the issues that come up when we try to put together these teams is that there's a different level of understanding of what is assessment in the various healthcare professions that we're working with, that not everyone understands the strengths and weaknesses for each type of practice and practitioner. It comes down to things like blood pressure. There was a question whether dental hygiene students or acupuncturists even knew how to take a blood pressure properly. So, and that was arrogance on the parts of some of the other practitioners to just think that they can't assess a patient care. Most practitioners in these fields have a very high level of commitment to their own programs. It took a long road for most people to become a naturopathic physician, chiropractic, acupuncturist. And so to decide that the patient is better served by some other discipline is difficult. There's also a significant misunderstanding about how integrative practice model fits with the educational goals for these disciplines that are often standalone schools with their own clinics. So how does that work? And then there's the usual problems with funding and faculty expectations and workload. If I'm going to be part of this clinic, does that count 4 hours towards my overall faculty load? The strengths we've seen from this clinic is that the students do become parts of a team. And it's interesting to me because most of them take anatomy together, they take physiology together, they take, the human body is the human body no matter what perspective you come from. And yet they kind of drift apart after the first 2 years, and when they come together as a clinic, they do manage to make a team. Intern communication is better now across the health clinics, in my opinion, not just within this one clinic, but now that we talk to each other, we actually talk to each other on a day-to-day basis in all the clinics. We see significant improvement in patient assessment and a more organized care. Somebody coming in for back pain goes to the chiropractic clinic. They may apply ice. In acupuncture, we never apply ice. And so then we tell the patient completely different pieces of information of what they should do for home care. Now we talk to each other and come up with one plan for that patient. And there's a greater supervisor interprofessional respect and understanding that we do understand what the patients need and what our students need and how we can work together. So a lot of these competencies are part of the ACAC competencies, which Liza talked about just a minute ago, so I won't go into them. But the key ones for us in this clinic were about interprofessional communication, teams and teamwork, and really focusing on evidence-informed and evidence-based practices. When we ask the students to self-assess before they start the integrated clinic and at the end, we can see that there is learning that takes place by participating in these clinics, that they are able to communicate much better, they're able to collaborate much better on their own self-assessment, and they're able to interpret data from other fields. The phones dental hygiene students and the acupuncture students now all talk about the tongues together. What does it mean when there's a thick white coating on the tongue? So we really want to promote this idea of integrated healthcare models and interprofessional care models for the good of the patient. And to do that, we have to teach the students. And it really starts in the teaching clinic.
Very good. I wonder if you might share, it's nice that you did the pre-post work with the students. Any more details on what they saw as their strongest outcomes, and any changes in their behavior post working in the clinic?
Well, as supervisors, what we do see is a better focus on prognosis than we see when they're in their own individual clinics, that they really think about what will make that patient better sooner. From the student's perspective, they gain a good deal of confidence in being able to communicate how we're all looking at the same human body but from different perspectives, and really make diagnosis cross those language barriers. Particularly from my perspective, Chinese medicine really doesn't talk like anybody else, and to be able to have that communication skills with their other interns will then carry over to their practice. Graduates from this clinic also reported that they're more able to get positions in integrated teams when they graduate, because they can say they already have those skills, and so that gives them a leg up again compared to their other colleagues from other disciplines.
Well, I want to thank each of you who presented. I think that you and the webcast audience will have had the pleasure of this smorgasbord that's brought in the variety of ways we're all trying to figure out how to envision what we need to be doing next to start doing it all better. One of the great themes we've touched on here of the last couple of days is that we need to be thinking radically about our direction and not merely looking at tweaking things around the edges. And there were some touches of radicalism in what you heard there. So I wanted to actually remind you on the webinar that if you have questions, you can send an email. I think there's an email address there in front of you as you're watching this. And please go ahead and send those in, and we'll get those to the speakers if you have specific questions for any of the speakers that weren't allowed to have time for at this point. And we are going to be reconvening the forum here and the webinar in 30 minutes, and so you'll be welcome back with us at that time. Thank you all, and thanks again to the speakers.